Good evening, or good afternoon, good morning, depending where you are in the world. Thank you very much for attending. My name is Simon Ramshaw. I'm the Managing Director of Erchonia Lasers. And we are the official distributors for Erchonia Corporation in Europe, the Middle East and Africa. It's my pleasure to be co-hosting tonight's event. I've been working with the Erchonia technology since 2012 and personally handled the launch of the Lunula laser back then, so it's always had a special place in my heart, as well as obviously we have other lasers within the portfolio. But I was also lucky enough, which I will give her an intro in a second, very lucky to come across is now Mrs. Martine Silverman, which was then Abraham's, back in 2012, and had a very good working and personal relationship with Martine, who has become a friend over the years, and I've always been very grateful for her help and support to get us where we've got to. So welcome, Martine. Can you hear me? It might be a problem. Oh, I can hear you now. That's right. Yeah, it was muted for a second, I think, there. I've got you now. I was just saying hi. Then I was going to obviously talk about tonight's event, which is a webinar on Beyond Fungal Treatment, the next generation in nail and nail bed healing, which represents a lot of change that we've implemented over the last year or so. Many of you will likely know Martine from previous, but I'll just give her a little intro for some of you who don't know her. She's the director and lead podiatrist at the London Nail Laser Clinic. And she qualified from the Birmingham School of Podiatry in 1996 and spent the first 10 years of her career in the NHS in London before working in private practice. In 2009, Martine set up the London Nail Laser Clinic with the sole aim of treating fungal nail infections using the latest laser technology. The London Nail Laser Clinic has always been proud to offer their patients the most leading edge equipment available, and they've been using the Erchonia Lunula lasers, like I said earlier, since 2012. But in addition to running a busy clinic, Martine took the role of clinical consultant for us in 2017 and carries out training for new Lunula providers, as well as offering ongoing support via the Facebook group that we have. She's lectured to many medical practitioners within Europe and further afield on the use of non-thermal high-energy laser therapy for onychomycosis and other nail disorders. And it's my pleasure again to welcome you, Martine, and hand the reins over to you.
Okay, right. So whilst I quite like using lasers, I don't really like using computers. So I am going to switch off my webcam in a second and bring up my presentation. And tonight is pretty much about how I use Lunula, why I think it is the best device around, and I have tried many. I've tried, over nearly 30 years in podiatric practice, many different treatments for nail problems. I am absolutely still learning about nails, about patients, about treatments, risk factors, and all these different things. So hopefully some of you will either comment or maybe ask some questions. I think Simon will let me know if there are any questions up. And if there are, I will do my best to answer them, but I'm always open to other opinions and to learning. So feel free to interrupt. Okay, webcam is going to go off. And presentation is going to come on. So I'm hoping that everybody can see my presentation. So
yes, we can.
Brilliant, thank you. Beyond fungal treatment, the next generation of nail and nail bed healing. So the reason that, usually when we talk about Lunula, we do talk about the fungal side of it, more so, I think, than anything else. And what I've come to realise over the last almost 13 years of using it is that actually that's not really the interesting part of the device. It's certainly an integral part, but not the interesting part. So I'm going to go through kind of my history in terms of Lunula and the London Nail Laser Clinic, which is my company, my podiatric practice. And we'll talk about, well, kind of how I treat. So 1 second. Okay, so I want to try and answer for you is, can we heal nails in order to eradicate fungus and prevent further deformity? And we'll see at the end if we're kind of anywhere near doing that. So my approach to treating dodgy nails, and the reason that they're dodgy nails is because everybody who comes in to my clinic who is unhappy with their nails starts off saying, really dodgy nails. My GP's told me I've got a fungal infection. My nail girl said there's fungus there. My podiatrist who I see locally has said there's fungus there. And in actual fact, I don't really take any notice of that there's fungus there until I've had a look at the clinical signs. I've found, a probable cause for what's going on. We look at what's in front of us. So my approach to treating them is to use the podiatric skills that I've learned over the last 30 odd years, then to use the thing that does what I cannot do, and that's Lunula. I can't stimulate a body to eradicate fungus or to begin healing. That has to come from something much more beyond me. But the other things I can try and do, reduce risk factors to prevent further problems, and most importantly, actually, is probably to educate the patient. It's taken me a long time to realise how little we all know about nails, how they heal, the risk factors, all these different things. So let's see what we're treating, or possibly who we're treating. So we have to look at the patient as a whole. Using something that's going to stimulate their body to do what we want it to do, there's no point if they're not a good enough patient for that. And I'll go into sort of a few more details about what type of patient we want in a minute. We obviously have to look at what's in front of us, their nails and the nail pathology. And then I'm a podiatrist. I treat using podiatry, using Lunula, and using advice and education. And then comes the important part, because it's really easy to carry out a few laser treatments, press a button a few times and say goodbye to a patient because things are starting to look good. But in actual fact, it takes such a long time for the healing process to complete. And during that time, you get wear and tear that we need to make sure that we prevent regression and relapse. So let's look at our patients. Well, the first thing is looking at their lifestyles, because in the same way that we go to a dental hygienist, have the plaque removed from our teeth, and then go home and eat and drink again, and we may well brush, floss and use mouthwash and all that, but we're still going to get damage, we're still going to get a build-up because we're eating and drinking. Nails are no different, particularly in this country where you wear shoes and socks the majority of the year. So we have to look at their lifestyle, what job they may have. And I see patients who come in sometimes in flip-flops or sliders, sometimes in trainers, sometimes in stilettos. That's the first thing I tend to look at. What are they wearing on their feet and how often do they wear these shoes? What job do they do? Do they have to wear formal shoes? Are they still working from home? A whole load of things. What hobbies do they have? Most patients tend to have some sort of hobby that may damage their feet. So might be dancing or badminton or something that's not particularly sporty, but perhaps they like going to certain places, hotels, and they walk around barefoot. I've really said about their shoes, but socks are equally important, if not actually perhaps more important, because when you're looking at people's socks, they're often too tight. When a patient takes shoes and socks off, you can often see a nice ridge on their skin where they have been wearing their socks. Also, socks are often damp because we wear them all day and they gather sweat. So we talk about what their socks are made from, and we will discuss this all a little bit later on. I look at their nails. So most people come in and either they haven't touched their nails since they booked the appointment, which can often be several weeks in advance, or they have cut their nails the day before. I'm not sure if it's an equivalent to brushing your teeth before you go to the dentist, but it's quite nice to see nails in their sort of slightly more natural form, but just not too long. When I discuss with patients about nail care, quite often they will tell me, you know, hey, I don't like to cut them too short, but actually toenails in particular don't need to be particularly long. There's not that much function to them that we need them long, whereas fingernails should be a bit longer. We should have a free edge so that we can grip and pick things up and scratch and all the other things. Also, yeah, a lot of people come in with remnants of nail varnish or even full gels on, even though I've asked them to take it off. So I'm just starting to get a bit of an idea of what's going on with their nails in particular and what risk factors can affect them. Obviously, as part of my consultation, we talk about their health. Generally, the rule is the younger and healthier you are, the faster we're going to get results with Lunula, because it works with the body. However, saying that, I do have patients who are fairly elderly, have very poor circulation, maybe immunosuppressed. I've got a couple of kidney transplant patients that Lunula seems to be working fairly well with. But I have to look at what's in front of me again. So any illnesses they may have, any medication that they're on, mostly what their circulation is like, and in particular whether their skin is sort of dry or sweaty. And that starts to give me clues, because people with sweaty feet tend to have an active fungal infection. People with dry skin tend to have poor circulation and therefore very slow growing nails. They don't necessarily have an active infection at the time. Once we've kind of looked at all that, then we look at the nails. And I went back a while ago, a few years ago, and had a look at my university notes and didn't really learn a great deal about nails. So yes, I learned the structure. Yes, I learned some pathologies. No, I didn't really learn anything about how the nail area heals. So if I'm teaching you stuff that you know already, I apologise, but I think it's really important that we actually understand the importance of the nail. And when I say the nail, I mean the whole area. So from the matrix, how it grows, the nail bed, and what that brings to the area. Nail plate, which is pretty much dead, has blood ending. We can cut dead tissue, which is why we can most of, if it's not any pain, or remove attached without discomfort. And then the three parts that I think are really, really important: eponychium and parenchyma. So the seals that eponychium, the seal surrounds. So when I'm looking at a patient's nail, and quite often they'll be detached, there'll be onycholysis, there will be discoloration. It isn't always fungal related. There's going to be thickness with some nails, there'll be flaking with other nails. So I'm looking at what's going on and how long this has been a problem for. And I generally need to ask patients, because they come in having had a problem for an awfully long time, when did it start? How did it start? Probably most importantly, has it changed in the last sort of 6 to 12 months or so? And that starts to give me quite a few clues. So there are loads of weak points. Nails are not particularly strong. They should be dry, they should be hard, they should be attacked, and they should be intact and fairly thin. But the damage that we get to nails, and that's both toenails and fingernails, is really quite astonishing. And for most people, they'll damage their nails fairly often, but they don't tend to have nails that are of poor quality. So quite often the damage goes, most people don't look that closely at their nails. They might cut them, they might notice a bruise, but they don't tend to see any discoloration on the nail bed or any splits that happen, because we do tend to heal fairly well, but the older we get, the less we're able to heal by ourselves. So the weak points, obviously nail plate is the big thing. So our nail bed is pretty much shield shaped, and if you've got a nail plate that is fully attached to it, then the chances are you're not going to be getting a fungal infection. It's only once you start to damage that nail plate that you then start to go down the rabbit hole of really. So doom. In good condition, or as we get older and our circulation becomes poor and our glands stop producing oil in our nail beds, then we tend to get splitting, chipping, discoloration to the area. A lot of patients who will use nail varnish, so they may have had a little bit of discoloration or a bit of, they'll cover it up and then they'll continue to cover it up, and they're just providing the area with an environment that is not conducive to nice looking nails, really. And it is about nice looking nails for most of our patients. For some of them, it's about, talk later about that a little bit, but mostly it's about what their nails look like before we talk about infection, discomfort, and all different things like that. Nail beds should be nice and pink and healthy. As you get older, they tend to look far more grey because circulation becomes poorer, damage to a nail bed, and particularly if you break the hyponychium, so the seal at the distal end, you're going to end up damaging part of the nail bed. And whether that heals or not depends on the patient. The infection tends to get into the nail bed. That's where fungus really activates. There are fungal spores everywhere, and there's bacteria all around as well, particularly if people put their feet in swimming pools, the sea, their feet get hot and sweaty, you get moisture, they go to the nail salon, all these different things are areas where we'll pick up infection. If you've got a nail plate that is sitting on a healthy nail bed and all the seals are in place, you're not going to be getting any infection at all. You will probably have fungal spores sitting on there, but they're not active. It's no different to fungal spores sitting on a table. It's not an infection. They're just there until they die. So the natural seals, as said before, are really our ports of entry for the most part. Even if you drop something in the middle of your toe, well, you may well break the nail there, but quite often it will just bruise the nail and the seals around the nail will start to detach a little bit rather than too much damage actually in the centre of the nail. Looking at the causes of pathology, acute damage, something people don't do very often. So if you drop a weight on your toe, you're likely to be more careful next time because it really hurts. Chronic damage is something that we see all the time, consistent damage from footwear, from different activities. It appears over time. It's very rare that if you have an acute issue that you're going to continue to damage the area from an external source. You may well not heal particularly well, and then you get further damage from shoes over time if you've got a nail that's not attaching properly or that's thickening up. So damage is really the start of all other pathologies, or most other pathologies, particularly local ones. So if you don't have damage, you're not going to get any microbes in the area. They're not going to cause a problem. You're not going to get an infected nail bed. The two main problems that we see in terms of infection, obviously, are fungus and Bacterium Pseudomonas being the main one. Mostly patients get these from external sources like gel nails or other kinds of false nails, or going into the garden, and a lot of patients seem to garden without any shoes on. Bacteria is very easy to get rid of. Pseudomonas actually is pretty simple. You don't necessarily need to use Lunula if you think it's just a purely brand new Pseudomonas infection. Fungi is a lot more difficult for us to get rid of. Then obviously you've got the other kinds of infections through ingrown toenails, things like that. So ports of entry into the nail bed. Then the other causes of problems tend to be systemic. So when we age, our nails dry out, our circulation gets poor, we may not be able to cut our nails so well, our feet might become flatter, our shoes therefore become narrower in relation to our feet. We have poor circulation, that tends to be a really big indication when someone comes into clinic of whether Lunula can help them. And generally, if someone has poor circulation and we use Lunula, and this is really what we're going to be talking about a lot a bit later on, that's where we can increase the blood supply to the area where circulation, it's probably, the one thing that most of my patients complain about. I have cold hands and feet, I have Raynaud's, my feet, get, they go all tingly, I have to wear socks at night, all these different things. But a few years ago, in fact, it was during COVID when I saw a patient who had multiple sclerosis and had lots of itis her feet. I actually used Lunula, but before I did, I used the surface temperature to see what her feet temperature was. And then I used it straight after Lunula, and one foot had increased by 1.2 degrees and one by 0.8 degrees. So her feet were still really pretty cold. And I purely used Lunula at that point to experiment and see what was going to happen, because I didn't feel that she was a candidate for healing her nails. She had too many other problems. She was in a wheelchair. When we spoke about it, actually just filing her nails made them more comfortable. She didn't want to go any further with laser treatment, but it was quite interesting to see an immediate effect to her circulation. And I will show you a little bit later a couple of pictures of a Doppler taken by a colleague out in Arizona, out in the States, many years ago when he was carrying out some research on Lunula. I will show you that later. So autoimmune disorders are another problem. And what I'm finding is that patients, more and more patients, tend to be coming in with autoimmune problems, so psoriatic nails, psoriasis, psoriatic arthritis, lichen planus, but also many gut problems, gut health problems, systemic problems, IBS, colitis, Crohn's, all these different things. And certainly over the last few years, and I think we may well see later on a lot of information coming out about COVID and the effect it's had on people's immune system. And an awful lot of our immune system is within the gut. And so gut health is something that I try and work with my patients on, particularly those who talk about their gut problems anyway. So I'm a podiatrist, I do podiatry. So for me, once I've had a look and I've kind of worked out what I'm dealing with, why we think there's a problem, what the risk factors are, I'll start my debridement. I will take off as much as I can do. Nail plate is dead. If it's not attached, it shouldn't be there. All that happens when you've got thick nails or you've got onycholitis is wearing shoes just causes more problems to the nail bed because you get bruising, you get some discomfort. Debride as much as you can. I use a podo spray drill, I use nail nippers, I use various burrs, usually ceramic, some tungsten carbide. I make the nails as smooth as I can, I take them down as much as I can, and I bevel them so there are no gaps left anywhere for anything else to get underneath there. The probably best part about debridement is how they look afterwards. Most patients haven't seen their nails looking quite as neat or quite as discoloured. Once you take off an awful lot of the debris, things look better. So that's kind of the first thing. I then discuss the whole pills and potions. So I have patients who use systemic medication, have used it in the past. Sometimes they've had some decent results for a little while, and then the medication has been stopped and it hasn't quite got rid of the problem as far as they're concerned. The majority of my patients have tried topical solutions in one way, shape or form. They've come to me for a reason. These things aren't helping them significantly, and the main reason they're not is because they may well have eradicated the fungal infection, because that's what they do, that's what they say on the tin, but they haven't actually healed the area. And so it may be a few months, it may be a year, whenever it is, there'll probably be more active fungus happening, there'll be more damage to the area, because if you haven't attached the nail plate to the nail bed, then you're going to end up with a lot more problems again. I have patients who have had surgery. If they've had a nail avulsion with Fungal, there's nothing I can do if that's worked, because once there's no cells really coming through, even Lunula can't encourage new cells like that. You're just going to make quite a nice healthy nail bed, but nothing coming through from the matrix if it's been phenolized. Personally, I don't like surgery. I don't like nail avulsions, purely because if you're taking off nail that is attached, you're going to be causing more problems potentially. So once a nail is detached from the nail bed somewhere, the nail bed will start to shrink. So if you don't have a nail plate holding all the borders in place, the distal border, the lateral fold, everything in place, then you're going to get a nail bed that humps, and it's very difficult for a nail to reattach to that. So I don't carry out nail avulsions, but I do debride. So if something's not stuck down, as I said before, then we'll remove it anyway to limit further damage. But if it is stuck down, it stays stuck down. And as you can probably gather, I use laser therapy. So I started off back in 2009 using a thermal laser. I used the pinpoint foot laser for a few years. I didn't really like it. I found that it heated up the nail, and so it killed any fungus that was there. That was great, but in doing so, it was incredibly painful for patients, and it was quite destructive. It was very difficult to treat aggressively, because what you don't want to do is cause a burn to any healthy area of the nail bed. But it was probably about 50% effective at best, because most patients don't actually come in with an active fungal infection. Generally, they come in with damage, some chronic fungus perhaps, and a few patients, maybe 15% of those who I treat, come in with an active infection. So the problem with traditional treatments is pretty much what I've just said, that if patients don't have an active infection, you've got nothing to treat. You've got no fungus to treat. If someone's had a horse tread on their toe and the nail's been damaged for 20 odd years, but there's no signs of infection and there's no athlete's foot, it's never spread, we're just looking at trauma. So all of the treatments that are below, the topical applications, the systemic medications, surgery to an extent, although that just causes or can cause slightly more damage to the nail bed. LED and thermal lasers, they don't actually stimulate healing so that we can start to fix the problem. They do, in fact, just treat fungus in many cases. So when we look at how nail lasers work, the two that I've used are thermal lasers, as I said, pinpoint, and non-thermal high energy lasers, Lunula. Thermal lasers are destructive by their very nature. So they break down the fungus by heating up the area to about 56 degrees or so. They're there to kill pathogens, and they do that quite effectively. The problem comes, as we've said, that we don't always have the pathogens there. So I now look, or when I treat a patient, I prioritize, does somebody have an actively spreading infection? If they do, fungus is my priority. That comes first. if they've got tinea pedis, and particularly if it's quite acute, if their infection is spreading from nail to nail or foot to foot sometimes. You have to look at the clinical signs that are there. There's no point in having sort of tunnel vision and say, right, I'm just treating a fungal infection because a patient has come in and said, I went to the doctor and they said I've got fungus. Because most of the time when patients come in, they don't have an active infection. So using something to kill fungus isn't going to be my main treatment of choice. What I have found is that by stimulating the health in the area, which is what happens when you use Lunula, that's when we start to get the response that we need. So when you work at cellular level, you don't generate heat, you generate chemicals that need to be there. So the body responds to all different things by creating chemicals. We have lots of chemicals going around our body, but until we deliver the correct photonic energy to stimulate the responses that we need, we're not going to be able to stimulate healing in an area such as a toenail or a toe. So let's promote healing, circulation, tissue repair, and let's talk about how it does that. Before I do that, we'll talk about the difference between the photochemical reaction, which is what we want, and a photothermal reaction, which is not necessarily helpful for all of our patients. So let's talk about the sun. When you stand out in the sun, you have a photochemical reaction, you end up making or producing more vitamin D or extracting vitamin D from some of our cells. So we have receptors in all of our cells, and when you have certain light, that will stimulate the production of certain chemicals in order to generate the response that we need. When we use heat to try and do that, it doesn't really work because we're using something that actually doesn't stimulate healing. It's not necessarily good for us. Too much heat is destructive for people, for cells, for plants, for all different things, for fungus, obviously. But when you're doing something that just makes the area healthy, then you're going to get a whole load of different reactions. So you get your increase in blood supply by increasing the nitric oxide in the area. And when you get that increase in blood supply, you get an immune response increase as well as a nicer environment for cells to regenerate. You enhance collagen synthesis, which is really important when we're trying to attach nail plate to nail bed. And you just get repair of the area. If you've got a wound there that's nothing to do with the nail, but maybe on the foot, you'll see it will actually heal a lot quicker. It's quite interesting to use Lunula not just for nails, and this is why I think it's a really important tool in my clinic, because I don't really use it for fungal infections, except occasionally. I tend to use it on patients to stimulate healing because I have patients who are elderly and they may be susceptible to chilblains. It's a really good tool to use during the winter months to increase the circulation, to reduce the chance of patients having chilblains. So a photochemical reaction, well, it's just a reaction that's initiated by the absorption of energy from light, so from photonic energy, get photobiomodulation. And the consequence of molecules absorbing light is that you get excited molecules, and those molecules then start to change, and you get chemical and physical properties that become very different to the original molecules that were there. So when we look at non-thermal laser and we look at the electromagnetic spectrum, we're dealing with visible light. And that, as you can see, is pretty much in the middle of the electromagnetic spectrum here. Thermal lasers are generally infrared. They tend to be above 700 nanometers. Visible light is between about 400 and 700. UV, so sunlight, is below the 400. And photonic energy is measured in electron volt. And the shorter the wavelength, say the 11 meters, the higher the energy that's there, the electron volt. And when you go to the longer wavelength, so infrared, you get the heat, but you don't get very much energy there. So you would need more power in a laser in order to get the effect that we get with less power but more energy. So there was a study, well, there's many studies, Harvard University, but one of them is a photochemical study, which was called the Harvard University Biphasic Dose Study. And it looked at photochemical reactions and the light energy and how many electron volts you would need per photon to create that photochemical response that we need. And when we look at Lunula, we have a 405 nanometer diode, which is a violet diode. That tends to be our antimicrobial diode, the one that gets your body producing hydrogen peroxide. And that's got 3.06 EVs. And then we go to a little bit higher up the spectrum to 635, our red laser, which is 1.9 EV. So if you need 1.7 EVs in order to create a photochemical response, we're going to be getting that with Lunula. Once you go higher up the spectrum, they determine that 808 nanometers gives 1.53 EV. Pinpoint was 1064 nanometers. And there are many, many lasers that are on the market that are useful, that are thermal in how they treat, and they have different diodes. Some of them may have a shorter nanometer or wavelength diode in there, but most of them will work with the higher wavelength, and so they don't get that 1.7 electron volts per photon, which means that you're not going to get photochemical reaction that we need. So only non-thermal lasers are ones, and they're in the visible light spectrum. So with Lunula, so Erchonia's non-thermal laser, as I said, we've got the two diodes there. One is the red one, and that to me is the important one for stimulating healing. The violet diode is the important one for antimicrobial properties. So when we use Lunula, both of them work in tangent, they work together, you don't switch one off, they're both, so you get the benefit of both. But what I have realised is when I'm treating someone who does have an active infection, who does have athlete's foot, who has a spreading infection that's probably fairly new, and I want to focus more on keeping that hydrogen peroxide high, I'll treat quite close together because of how the diode targets the complex 1 and 2. So you get NADPH oxidase on the electron transport train. And so we're getting the antimicrobial plus the anti-inflammatory effect, and you get an increase of about 25 to 30% of hydrogen peroxide when you use Lunula. If that's what my priority is, treating fungus, then I want to keep that hydrogen peroxide high. I don't know how long it takes the body to use up the hydrogen peroxide, so I want to treat fairly close together. Most clinical studies that have been done, and there are many of them that have been done around the world, concentrate on positive fungal mycology, treating generally weekly, sometimes with a few weekly treatments, then followed by some monthly treatments, and generally keeping the hydrogen peroxide high. And what we find is it's very high efficacy for getting rid of fungal infections. You then get negative mycology, and you start to see the clinical signs of fungus disappearing over time. With the red laser, that's the one that gets your body producing nitric oxide, and it targets cytochrome C oxidase, and that enhances the cellular respiration, circulation, and healing. We get regeneration of tissue, but the effects of the laser really take about 6 weeks to come down to baseline. So once you've got nitric oxide being produced, that's a really powerful vasodilator. You then increase the blood supply to the area, and then you start the regeneration of the cells. And this is really what we're looking to do. So the diodes work in tandem, but I change how I treat patients depending on what I'm seeing in front of me. So when I start my consultation and I look at what's in front of me, I will then decide whether to start off with treatments close together in order to target any fungus that's there, any infection that's there. If patient has come in and they've had the problem for an awfully long time, and most patients have, and they've been using systemic or topical medications or even thermal lasers, then I tend to look at whether I think there is still an active infection. Often you'll see signs of fungal debris, fungal tissue, but you won't necessarily see the bright colours that are really associated with fungus. You won't necessarily have the smell that's associated with active fungus. You won't necessarily have signs of acute tinea pedis. So it's all about putting a picture together in order to decide the best way to treat and the intervals between treatment. If I see someone who doesn't have any signs of fungus, has never had signs of fungus, but does have signs of acute trauma, then I'll carry out treatments at least 6 weeks apart to give the body a chance to increase the circulation in the area, come back to baseline, and then increase it again on the next treatment. I feel that if I treat close together and I'm trying to heal the damage that's there, that's my priority, then actually it tends to take longer to do so because the body isn't producing enough or doesn't have enough blood supply. If you're carrying out 4 treatments, you're only going to get an increase in blood supply at the first treatment if your 4 treatments are weekly, because your body just isn't going to keep on making nitric oxide. It can't do that over time and keep on increasing the blood supply there. There's only so much you can do. So this is the Doppler ultrasound that I was talking about earlier with Dr. Kerry Zhang. He did this several years ago, 13 plus years ago. And on the top picture, you've got the nail there, you've got the actual nail plate. And the hyponychium sort of up here, and you can see the germinal matrix is down here, and there's not a great deal of blood supply to the area. After Lunula, you see a massive increase in blood supply, much further up the nail, and that is what we're looking to do. That's what we want to do. So in the same way that when I treated that patient who had multiple sclerosis and I tested her surface temperature, this is why, because the increase in blood supply happens quite quickly and it stays around for a while. So the nitric oxide production not only improves the circulation, which is great for so many different things, but that also gets the collagen bonds stronger. And we have grooves on our nail bed where we've got collagen production and the nail plate manages to adhere to those grooves. When we don't have very good collagen in the area, then the nail is just going to separate, nail plate's going to separate from the nail bed. Once you've got separation there, then your antimicrobial defense is low, and if we can increase the blood supply in the area, you get your increased immune response. So that in itself should also help to reduce the fungus in the area. The reason that I think Lunula is superior to other treatments, well, a variety of reasons. Firstly, having used thermal lasers that are really painful for patients, and when someone says they may have some discomfort, that's not really true. A lot of patients feel a lot of discomfort and pain because you're heating up a very small area. With Lunula, you don't get that at all. At worst, not even worse really, you might get some mild pins and needles. As you increase the blood supply to the area, inevitably, like when you sit on your leg, it's going to start waking up the nerves and just produce that little bit of tingling there. I haven't come across any negative side effects from Lunula. I've come across plenty of positive. However, with thermal lasers, negative side effects are obviously that you can damage the area, you can use it a little bit too aggressively, cause burns. You're not necessarily going to be treating the whole area. With Lunula, the foot goes into the device, or the hand goes into the device to treat hands as well. And so the whole area will get treated. With thermal lasers, there's a lot of human error that can be associated with it. And also, if you don't debride nails so that they're nice and thin, you're going to be getting areas missed if you've got a thick nail, because you tend to have a penetrative depth for thermal lasers, whereas with photochemical reaction, you don't get that depth. The energy keeps on going until it's taken up by the cells that need it. It's not destructive. And because you haven't got the heat element, you can use it on neuropathic patients, patients who've got all kinds of metal in their feet. There's nothing to heat that up. It's great on diabetics and those with PVD. It treats the entire area, and also very slight systemic area as well. Obviously, it's not going to treat further than what's in the lunula itself, but it tends to improve the health of the whole foot or hand. You can't get microbial resistance. You're treating with light. Light is really natural, and our bodies need it to obviously keep us alive. Now, so it doesn't interfere or interact with any systemic medication. That's true. However, if you have a patient who is on medication where photosensitivity might be a side effect, then treat with caution. The worst that I've had with a patient is slight redness on the skin, no discomfort, no pain, and it went within about 3 days. I tend to ask patients when I'm doing my consultation whether they, if they're out in the sun, if they suffer from photosensitivity or with other kind of treatment that they may have had. And the majority of people don't. It doesn't seem to be a problem, but it is a consideration, something to think about. I have patients asking me, that if they're taking blood thinners, is that a problem because we're obviously increasing the blood supply to the area? It's not a problem because the patient isn't going to bleed unless, of course, you whilst debriding, in which case I probably wouldn't be using the lunula until they've healed quite well. But when I take a consultation and I look at what's going on with my patients, what medication they're on, what health issues, their lifestyle, there's very few patients that I won't treat. So I won't treat anyone who is pregnant because pregnancy is excluded from clinical studies. And whilst I'm 99.9% sure there won't be a problem at all, I wouldn't take that chance. I don't have it in black and white that Lunula is safe in pregnancy. I do treat patients who are breastfeeding because there's no problem with breast milk. It's not like using a topical or taking systemic medication. It doesn't get into the breast milk at all. Obviously, it's just light, so that's not a problem. Patients who have new scarring on the area that you're treating, I would wait a year because you don't want to discolour the scar. When someone has had surgery that they shouldn't really expose the scar to sunlight, so I tend to go by that as well. And generally, if patients are immunosuppressed, I take a view, and I treat many immunocompromised patients, and we tend to get fairly good results, but I do warn them that it may take longer. If their body isn't as healthy as we'd like it to be, then we might have to be a little bit more patient or add in some extra treatments. And I generally carry out 4 treatments. If I have patients who have a very active infection and I'm treating close together, then I will add further treatments on to deal with the damage once we've got the infection under control. So again, if I'm treating someone where there's no clinical signs of fungus, I'll do 4 treatments. If I'm treating someone where there are signs of active fungus, then I'm going to probably do 6 or 8 treatments. There's no chance of liver toxicity. And as I've said several times, we stimulate healing. And actually, I haven't found anything else. And I get calls from various companies who are either supplying or doing research on various fungicidal treatments, and none of them do what Lunula can do. I haven't found that anything that can do this. And so I now use it for patients who don't have nail problems, but their feet, their hands, there are some issues there, be it skin issues or circulatory issues as well as fungal issues, because I find that the healing side of Lunula is incredibly impressive. So can we avoid a relapse? Well, no, not always, but we can find ways to reduce the risk of it and be prepared for damage, infection, and slow growth in the future. So let's look at common risk factors. So acute trauma, well, you can't really stop that. If someone's going to drop a brick on their toe, they're going to drop a brick on their toe. I've got a patient who I'm treating her fingernails. We don't know why she has problems with her fingernails. At first, we thought it may be something like rheumatoid arthritis, because she had swelling in the joints as well, but that's all been ruled out. However, Lunula has been helping, and her nails are now much stronger, far less painful than they were. However, she sent me an email a couple of weekends ago saying that she had just caught her thumbnail in a car door and she didn't know what to do. It was incredibly painful, bleeding everywhere. And I asked her for photos and told her to go straight to A&E, and that I would see her on Monday if need be. Anyway, it has been healing quite nicely by itself, and I'm going to see her, I think, next week. In the end, we decided that she didn't actually need to rush in and be seen too quickly. But, she was mad at herself. That was something she possibly should have avoided, but she was rushing and it happened. We'll use Lunula to make sure it's fully healed. Ill-fitting footwear, biggest risk factor of patients. What people tend to forget is that whilst your feet may not grow in length as you get older, they certainly tend to grow in width, because we put on weight, our ligaments get lax, we pronate more, we have hip problems, knee problems, back problems, we compensate at various joints. So when we are wearing the same size shoe that we've worn since we were 14 years old, because that was the last time we had our feet measured, that's not really going to work. And when I have this discussion with patients, probably 90% of them say, oh yeah, by the end of the day, they certainly do feel really quite tight, because feet swell throughout the day. And most of my patients, when I stand there in front of them, I say, listen, go home, take half an hour, try on the shoes that you wear most often, and stand there. Just stand in your relaxed stance position and just see if you can feel anything apart from the sole of the shoe or the inside of the shoe touching your toes. You shouldn't do. You shouldn't be able to feel anything at all. And nearly all of them will tell me the next time they've gone up half a size, they've gone up a size, yeah, they could feel that their shoes were a little bit too small. So that tends to be the biggest consistent risk factor, along with damp feet. And I say damp feet before I say socks, because if you sweat throughout the day and you're in a pair of shoes, you're at work all day, you're walking around, you're out for a jog, you're doing all these things, you're sitting with underfloor heating, your feet are going to sweat, even if you're not a sweaty person. And socks, tights are going to catch that sweat and sit on your nails and make them nice and soft. And soft nails are not what we want. Soft nails then get damaged by ill-fitting footwear. So we're looking at the really common things that cause problems, and we're educating our patients in how to deal with it. I don't think that onychomycosis is all that contagious. I think it's tinea pedis that's the problem, because when you've got fungus in superficial skin cells that are flaking off all the time, then you're going to be walking around and leaving a trail of it. When you've got fungus within nail cells, and particularly deep into the nail bed, generally those cells cling on to the nail that's there rather than sort of spread everywhere. So tinea pedis is a really big factor. Someone in the family may have it, or you might go to a hotel, walk on the carpet after you've come out of the shower, and that carpet would not have been steam cleaned. There's going to be some sort of fungus there from other people. Nail salons are not necessarily the most hygienic places. Most aren't governed by anyone. Some are superb and sterilise as podiatrists do. Some are not quite so superb. Feedback from patients, certainly in the last year or so, seems to be that a lot of nail salons are reducing the appointment time, and so they're treating quicker, they're treating more aggressively, and they're causing more problems. I try and convince my patients not to go to too many nail salons. It works in some cases, but not in all. Nail products, again, seem to be a big problem, particularly since COVID, where I think when people started using products that they bought from Amazon or elsewhere online, these products aren't particularly great. They get quite a cheap UV light to set the products with. They're causing problems with their own nails. And again, a lot of the salons are using cheaper products as well nowadays. Covering a nail in nail varnish, gels, shellac, all different types of things, and then leaving it on for a long time and then aggressively removing it is not ever going to be something that's good for your nails. And then you've got people who share lots of foot and nail related things, nail clippers, shoes, nail files, nail polish, gels, all these different things. Again, if you don't know where it's been, not a good idea to share it. So it stimulates the body to heal the nails. That's great. It does what we can't do, but it is a temporary effect. So as we say, it lasts about 6 weeks in terms of the red laser, and probably less in terms of the violet laser. So we need to look at the lifestyle factors that play such a crucial role in order to prevent further damage and reinfection. The majority of people I see have treated their nails in one way or another, but they've never managed to get to the point where their nail is fully attaching to their nail bed and they don't get any further damage, either because they haven't had the advice or because they're taking or using a fungicidal, which doesn't really help in terms of the damage that's there, or they're just not listening and they're just causing more problems. So our patients have to adopt habits that are going to support circulation. With good circulation, you get good foot health, decent hygiene, and overall good nail health. So that is generally keeping nails short, keeping the feet dry. I advise my patients to dry really well once they've got out the shower. A lot of people tend to go out the shower, dry their bodies and pull their socks on. That doesn't work because it just, again, makes us damp and the nails soft again. So I manage risk factors in my job. That's what I tend to do with patients. And when I treat someone, I tell them that it's really a 3-year kind of program that we're starting on, because nails generally take about 12 to 18 months to heal, or nail beds to heal. And then you need to have another cycle of nail growth once the nail is fully attached to the nail bed. So that can take us up to 3 years. So long as we don't get too much damage throughout that time, then you can get the nail pretty much back to normal in many cases. The way I tend to manage my patients is with routine podiatric care. So hygiene, keeping them clean and dry. More and more patients seem to be drying their feet with hair dryers, but advise only do it on warm rather than hot. When you've got long toenails, particularly in shoes, you're just going to, if you walk down a hill, the nails are going to be pushed back. So you're going to start to get both arms going to get ridges there. Retronychia is a really big problem in patients, and also your hyponychium will just break. The seal there won't be able to withstand that pressure. So keeping nails short, you don't really need to have very much of a free edge at all with toenails. People might like longer fingernails, but again, they don't need to be too long. Wearing breathable footwear, so the trainers nowadays tend to be a lot better than they used to be, much more lightweight and breathable. However, obviously formal shoes tend to still be a bit of a problem. Socks, I find, are the biggest problem though, because cotton socks don't seem to be manufactured how they used to be. They tend to get holes in, but also they tend to hold a lot more sweat. So I suggest to my patients that they wear bamboo socks in the summer or wool socks in the winter. Nice and breathable. If they're at work all day, take a spare pair of socks with, and at lunchtime go and just give your feet a nice dry and change socks, and wash socks at 60 so that you can eradicate any fungus that might be there. I had a patient who works for a washing machine manufacturer, or worked for one, and when I said about washing socks at 60, she said that her company had carried out some research on, I think it's Ariel, where they tell you to wash at 30 because it kills all germs, and they determined that germ really wasn't a real word, it was just a marketing ploy, and actually fungus was not broken down at 30 or 40 degrees. So I advise patients to either wash at 60 degrees or iron their socks. Sanitize shoes. I use shoe spray. I use ultraviolet light shoe sanitizers, and obviously nail cutting instruments. I suggest to patients that if they can, at least get themselves a saucepan, stick their instruments, their nail clippers in there, and sterilize. So heat up, boil for a good 20 minutes or so, and just use the instruments themselves. That should suffice. And to use disposable emery boards rather than glass or metal ones that you keep on getting nail cells attached. So when we look again at patients, you need to talk about diet and nutrition. And patients often ask me, oh, do vitamins help? The answer is, I can't definitively say. However, I can advise on diet, on different kinds of supplements. So a high protein diet is going to be good. Keratin is protein, so increasing that is got to be a lot better than a high carbohydrate, sugary diet. I say increase collagen. Now, there is kind of a caveat for this. Some people find that they have an inflammatory response to collagen supplements, so kind of advise with caution on those. I have patients who take collagen and say it makes an awful lot of difference. I have some who take it and say it doesn't help, and I have some who have tried it and have had an inflammatory response. Omega-3 from flaxseed, walnuts, a few other fish, a few other things, is good for your circulation. And in fact, I take omega-3 supplements because I find as I've got older, my eyes are quite dry and has caused some clouding on my corneas, which was found by my optician, and omega-3 has really helped with that. So it's pretty good for you generally. Vitamin D, particularly in the UK, we all lack natural vitamin D from sunlight, particularly through the winter. And biotin also strengthens keratin. And ideally, you want your patients to reduce sugar and processed food. When I talk to patients, I will always ask them if they find that their diet impacts their gut in any way, whether they suffer from thrush or spot rot or anything that has a fungal yeasty element, because often patients do have candida. And circulation, exercise for healthy nails, so that we can all exercise to increase our blood flow. Doing, if you sit on a plane or you're sitting at a desk all day and you're doing some foot and toe exercises, then hopefully that will temporarily as well increase your microcirculation, as will massage. And I ask my patients when they dry their feet, just always, massage around all the nail folds and the ends all around the nail, so that you can just try and increase the blood supply again, because that's what we're trying to do with Lunula. So every little will help. And again, tight shoes, tight socks, you just get a tourniquet effect. So you want to avoid that. I explain to patients that wearing tight socks is pretty similar to wearing compression stockings. You're pushing the blood away, not to the area. So combining Lunula with lifestyle. Well, Lunula stimulates. Lunula has a temporary but a very good effect on the area that you're treating, but long-term nail health requires everything else that I've spoken about, a reduction in risk factors and an increase in foot health as much as possible. So education really does come into it, along with regular maintenance sessions. So I tend to follow up with my patients in two different ways. The first way is by photo. So I will email them and ask them to send me photos. Most patients can, after a while at least, cut their own toenails, file them a little bit, and it saves them coming in for me to have a look and say there's nothing for me to do. But I follow up with patients until we are both satisfied that their nails are either back to normal like their other nails, or as good as we're going to get it. And that can be generally 2-3 years or so. So beyond fungal treatment, next generation of nail and nail bed healing. Do I think I've answered the question? I hope so. I think we can heal nails. I think I do heal nails. I think I eradicate fungus, and I prevent further deformity of the nail bed. And if you can do that, then we're where we need to be.
Hi, Martine. That was brilliant. Thank you very much for your insights. We have a couple of questions that's come through. It seems to be a little bit more to do with the commercial side of things. Somebody's asking, how much do you charge for a treatment program?
So for 4 treatments to both feet, I charge £588. For 4 treatments to 1 foot, I charge £398. If I carry out a treatment beyond those sessions, then I will charge my routine sort of appointment fee. And for 1 foot, I'll just add on £29. And for the other foot, for both feet or hands, I'll add on £58. So I don't charge a great deal after the initial package. And the initial package is expensive because that's where there's a lot of attention and follow up within that time to make sure, and a lot of my time obviously being used to make sure that we start off on a good track.
Yeah. Do you do maintenance programs throughout the year to maybe try to help prevent reinfection, or just to accelerate the clear nail growth process?
I do. So I tend to take it very much on a case by case and appointment by appointment sort of thing. So if I have a patient, so I did quite a few maintenance or sort of extra treatments in February, because I have a lot of patients who are skiers and they always screw up their nails when they're skiing. But I find that just one extra treatment, once they've done the damage and it's new damage, tends to fix the problem quite quickly. With some patients, so particularly those with poor circulation, I will treat, do an extra treatment or so in the winter, maybe a couple throughout the winter, just to keep their nail growth a little bit better than it might otherwise be with their poor circulation. I don't use Lunula as a preventative. because you can't prevent damage to someone by using a laser. You know, what they do to their nails when they're not in clinic is whatever they're going to do. And so if you carry out preventative treatments and then someone, you know, drops a tin of soup on their toe, it's not going to prevent the damage and possibly the infection that might go with it.
Thank you. Yeah, I think, you know, when we set out on this, when we looked at Lunula in a lot more depth, and we looked at everything that was specifically on the market, I think you covered very well the fact that the majority of things, if not all things out there, can work to a certain level on eradicating an infection, but it's what it leaves behind. And this is where a lot of our focus is. And anybody who's still on the call, we've developed a new practitioner brochure and also a new patient leaflet, which again talks about, yes, the fact that Lunula works on fungal nail infections, but also the benefits it has to the health and wellness of the nail and the nail bed. So please, when you receive the email through thanking you for coming on the call, please reply if you would like the latest copy of that information. The second question actually leads from the first one, which is, how do patients perceive the value of Lunula treatments compared to more traditional methods like topical treatments or oral medications?
So patients, when they first come in, they are expecting Lunula to be this magical, you know, big, great cure. And actually, I explain to them that quite simply, it's a tool that I use, and it isn't just the laser that is helping them, it's me as well. And so the service that they get, Lunula does what I can't do, and I do what Lunula can't do. So between myself and the device, actually we give very good value for money, and patients seem to be incredibly pleased with, you know, their treatment. I do have some patients, and it always makes me laugh when I say, oh yes, it's £588 for both feet, and they say, okay, that's per treatment. And I'm like, no, that's for full treatment. So sometimes I think I'm a bit too cheap, but you know, sometimes you should be.
Well, yeah, I mean, you know, I think like with any medical treatment, it's building up a realistic expectation at the consultation stage. I've known you long enough to know you're extremely thorough when it comes to this sort of thing. And I'm sure you'd probably agree that if it's explained correctly to the patient, then, and also you're thorough with regard to the consent form, lifestyle questionnaire, before and after pictures, etc. So then patients come back in, they sometimes can forget what it used and they don't realize actually they've had a very good outcome.
Yeah, I think actually if I'm going to, you know, sort of rank the most important things within the treatment, Lunula obviously will be number one because, you know, I can't do it without it. I would probably say that photos would be number two, because even if you do nothing else, you're going to get a change in the nail if you're using Lunula. Even if you don't even touch the nail, there's going to be a change. And these changes, it's only through doing this for so long and looking back at photos and, you know, that I realise the changes that occur within the nail area as it heals. And I know now, once I take some photos and the nail is, or the healing is at a certain point, I can then relax. And it takes a long time to get to that point with some patients and not so long with other patients. Some patients come in after their first treatment and tell me how amazing it is and the change in their nail. Other patients, it doesn't happen that quickly and it takes a while, and they come in and say, oh, they don't look any different. We look at the photos, and first of all, I take photos before and after I debride, and that makes a huge difference to patients to see that, because what you're looking at when someone hasn't been into clinic for 6 weeks is very different to after you debride and cut the nails properly, and what they can actually see and what you can see, and photos are really invaluable. Advice is probably, patients forget the advice. So make sure you give them written advice afterwards, because you have to keep on going over it. That's probably the least valuable part.
Great, thank you. Right, what would you say was an indicator that when nails continue to test positive for dermatophytes and or still appear dystrophic and discoloured, more treatment sessions would not be beneficial? So what would you use as an indicator?
So I don't test nails at all. I think fungal testing is an absolute waste of time when you're using Lunula. Firstly, I look at clinical signs of fungus. Secondly, it takes an awfully long time for nails to heal. So if you've got a nail that is pretty detached and it's going to take 8 months for that nail to start attaching and grow up to the distal border, in that 8 months, you're probably going to get fungus there. So the fungus that's there is causing a problem, because if it is, then you might need to add in some fungicidals for the skin, because that's usually where the problem is. But just having a positive culture is almost irrelevant until you've got the seals back in place and the nail fully attaching. By that point, you won't have a positive culture, or you're unlikely to.
Cool, thank you. What was it, the third one? This is, I suppose, a little bit more to me as well, but what kind of support or training should we expect to maximize our clinical outcomes and profitability? Yeah, I mean, look, you need to know exactly what you're doing. As Martine said before, you could put the patient's foot in the Lunula and you get some sort of response. However, as a company, we want you to get the best response possible. So from a training perspective, we have an e-learning module, which everybody does after they've purchased the device. And that goes through a lot of the theory behind how the technology works. It's important that you know this, because obviously you need to deliver it in a concise manner to your patients if they're going to trust you enough to spend £580 or whatever it is actually for the treatment. The second part is Martine actually carries out the Lunula training via Zoom. The actual usage of the device is pretty simplistic. You put the foot or the hand into the cage, and then you press start, stop, pause. It literally is that simple. And the red and the violet lasers are rotating around inside the cage. So the actual using of the device is pretty straightforward, but Martine is always happy to share her experiences, having a very holistic viewpoint as to the more people that are getting the best results possible with the way social media is now, the better it is for everybody concerned. And then the third part is we have a Lunula Facebook group, which even though Martine runs it, she always tries to encourage everybody to be. It's not always about her answering the questions, even though she does look at each one. We're talking about successes, we're talking about failures, we're talking about patients who are hard to treat. Just get a little bit of insight from everybody on the group. But Martine obviously, looks over that to summarize it. So yeah, we try not to leave any stone unturned. We want everybody to be, to give you the best chance possible to be successful. So you got anything to add to that, Martine?
No. No. There's always around to answer questions.
Is malignancy contraindicated, not on the foot?
Malignancy somewhere else? No. However, if you have got a patient who is undergoing treatment for cancer, I wait till they've finished the treatment. Obviously, depending on what treatment it is, firstly, they've got enough to worry about, and secondly, if it's a treatment that suppresses their immune system, then that's just going to be more of an uphill battle. So Yeah, I think that there is research going on in terms of cancer cells and low-level laser therapy, but I haven't seen anything published as yet. So it actually may be that low-level laser therapy is something that can really help, but at the moment we don't know enough about it.
Yeah, I think it's again, it's understanding, how the laser works. We don't actually use the word contraindications. We tend to use exclusion criteria, because anything normally in visible light is rejuvenating. We I think went through an analogy before, the photosynthesis effect of plants and light, the healing and the growth. However, the exclusion criteria for us on the research was active cancer. Wait until the patient is 6 months out of admission. But then we leave it up to the experts, the doctors, practitioners who are treating the patients. Worst thing that could happen would be you just wouldn't get the response that you would expect, because the immune system, I think you covered this before, Martin, is too busy fighting the cancer and anything else that's specifically going on. Probably the last thing on its mind is a fungal nail infection. Obviously, photosensitive epilepsy, which the light's contained within the cage, so that doesn't always represent an issue. But it's more exclusion criteria rather. And Martin got the main one before, which was pregnant women. But yeah, with active cancer, it's just best to, I suppose, let the patient get to the end of their treatment program and beyond, and then you can deal with their what's this one finally? What would you say to podiatrists who are still using infrared or LED based devices and are unsure about making the switch to the Lunula laser?
Very simple, do it, switch. I see so many patients who have been somewhere else and had other types of laser therapy and have paid an awful lot of money for not very much of a response, often quite painful. Yeah, I say I don't use thermal lasers. Actually, I did use one recently on a glomus tumor, which was quite nice on someone's fingernail. But generally, I don't use them. I don't think that they are effective enough in terms of the damage, because they don't heal damage. They just are quite destructive. So I would say, you should change to something which actually does what we want it to do, that helps us in a really positive way. But I'm not a salesy person, as Simon will tell you. I try and tell people not to buy stuff, don't waste your money. But with Lunula, yeah, it was definitely a good move for me to buy mine.
Good. I'm pleased you're happy after 13 years. Coming up in June, I think it was. Yeah, exactly. Without going too much into depth, I think it's just more a case of understanding the mechanism of action. Our bodies have everything that we actually need to live a healthy, happy life, but maybe at a cellular level in our mitochondria, we just don't have the inspiration to be able to fix ourselves. And the way we like to think of the laser is that's the inspiration. It's making changes at a cellular level. It's making our mitochondria perform better and more effectively, which enables us to actually fix ourselves better. So we're still here 13 years on from when we launched it, and I think there's been quite a few technologies that have promised to be the next best thing, and they're not here anymore. So I think that speaks in volumes for the Lunula laser and what it can actually do. But just remember as well, and it's included in the e-learning module, it's a case with patients just to make them understand a little bit more about photochemical against photothermal. With the photochemical, we're delivering a high energy per photon into the body to create this photochemical response. And as Martin alluded to earlier, you need to achieve a specific amount of electron volts per photon. If you don't do that, the energy comes into contact with the water molecules, makes them vibrate and creates heat, which is a completely different mechanism. So, once you learn it, and we've got within the training material, we've got a lot of analogies which you can specifically use so that patients really understand the impact on exactly what it's doing. And I'm sure once they do, they will appreciate the value that they'll get. So I think that was the last question. Martine, again, thank you so much. You are the guru of Lunula laser fungal nail infections. You're the Yoda, I like to say, of fungal nails. So we always come to you. You've treated it within the clinic, probably over 1,000 patients now. So I don't think there's much that you haven't seen.
Don't think so. Hope not.
Yeah. And we're just so honoured that you are willing to participate in the training program after the Lunula, to give your wisdom to a lot of people who are starting out, who maybe try to overcomplicate things when it doesn't have to be that complicated. So again, thank you very much for your support, and thank you for your time and coming on tonight. Pleasure. Everybody else, thank you again for coming on. You will get a recording of the video sent through. So please ask any further questions once you get that through, and also ask Chloe for the electronic version of the new practitioner doctor brochure and the new patient leaflet, which goes a little bit more in depth into the nail health and the nail bed health, as well as the fungal infection. Enjoy the rest of your evening, and that has just worked out nicely for me because the Newcastle match is kicking off at 8 p.m. So thank you very much, everybody, and have a lovely evening. Take care.
Bye.